This segment of DelmarvaLife is sponsored by TidalHealth Home Care.
Well, the numbers are unfortunately on the rise as it relates to this largely preventable and treatable disease. We are talking about diabetes, which is appropriate because today is actually World Diabetes Day. It's a global campaign aimed at awareness with a theme, and this year's is well-being. That includes physical, societal, and mental well-being. With us this afternoon to learn more about this, Angie Carter, with the Clinical Manager Care Coordination, is that right?
Yes.
Okay, along with Jeannie Harp, who is RN Case Manager, Diabetes Education. Yes?
Yes.
Okay, I got all that right so far?
Yes.
Okay, that was the important part. Thank you for coming in and talking to us. But this is a really, really important thing.
Yes.
A lot of people, you know what, let me ask you this, just right off the bat. How prevalent is diabetes?
So in America, there is 11.6% of Americans that have diabetes. So that's about 38 million people.
More than 1 out of 10.
Mm-hmm.
Good.
Yes.
Is there a way to know that you have diabetes?
Some people say that they never have the symptoms at first,
Right.
but many of the symptoms that we hear is increased urination, increased thirst, fatigue, blurred vision, weight loss, and that's kind of what leads them to, seek help.
Vision is also a symptom.
Yes.
Wow. Is this hereditary?
Yes.
Yeah? I mean, is that one of the prevalent possibilities that you could have it too?
Yes. It is hereditary, but not everybody that's in the family will get it.
Okay.
You have a greater chance, you have a more significant chance of getting it if your family history is with diabetes.
Raises
but
the
it doesn't,
possibility.
yeah, it doesn't necessarily mean you will get it
Okay.
if they have it.
So then, okay, that's one maybe. As an educator, what do you suggest people look for?
That, like she said,
Everything's listed, yeah?
yeah. Plus, if you check your feet, if you are to get a blister and it's not healing on your foot, that's a sign you need to seek help. If you get confusion or you just don't feel right and get sweaty, then that's a sign that you could have low blood sugar.
Low blood sugar. And we were talking earlier, and people don't always refer to it as beatus like Wilford Brimley did, or diabetes. They call it sugar.
Right.
Their sugar, their blood sugar. So when it comes to education, how well does that carry over from what you know to what people do at home?
Well, that's one of the reasons why we're starting the program, because the doctors in the offices, they only have 15 minutes. So if you go in to see your doctor and they give you all this information,
Right.
it's just kind of confuse you. And they don't always follow through. It's a lot. They have to read their labels, watch their carbs, make sure that their sugars, because a lot of people think it's just sugars that they got to watch
Right.
for, but it's actually the carbohydrates. So that's where the education comes into play, because a lot of times people are in denial, and it's a big lifestyle change.
It can be a big lifestyle change, can it? Do you find people are wanting to make the change, or
Not
ooh,
necessarily.
I'm seeing expressions that say nuh-uh.
It's a lot. I mean, especially in our area, like the older population, meat and potatoes kind of people.
Right.
They don't want to give up their potatoes or their pasta or their
Right.
bread.
Right.
Then we also have like the Hispanic and the Haitian population who their entire diet is basically carbohydrates. So
Yeah.
it's hard for them to understand
How
Okay.
to eat
what
differently.
they.
So you've piqued our interest. How can we reach out for help?
So we actually have a program with TidalHealth Home Care that's called, we have evidence-based disease management programs.
Right.
So we have one for diabetes. So if you happen to be hospitalized for diabetes, whether it be a new onset or an exacerbation, when you're discharged from the hospital, the case managers there will a lot of times send us the referral so that we can actually put you on our program and go out and do that. If you're at home and you have diabetes, or your new onset diabetes from home, usually your primary care physician or the endocrinologist that's treating you can actually send us a referral directly.
Okay.
But we always tell people, like, if you just don't know what to do, but you know you need help, just call the office and we'll help you. We'll help you get the referral.
This is not
So.
something so complex or difficult or hard that I can't learn to do it.
Oh, no.
as a
Exactly.
diabetic.
Right.
Right.
Okay. Angie, Jeannie, thank you so much for sharing that. I've got a funny feeling you put a lot of people's mind to rest, like, okay, if I do have it,
Yes.
it's okay. We can handle this.
We can handle it. That's right.
Thank you.
Yep.
You're welcome.
Wonderful talking to you.